Okay, let's talk about testicular cancer. So, testicular cancer most commonly affects men in the age range of 20 to 40 years old. Now, again, it can happen in a younger population, just less commonly, and it can happen in an older population, but less commonly. But for men in that 20 to 40 year range, that's the peak incidence, and for men in that age group, it is the most common type of cancer. Granted, cancer is not that common in men in that age group, but that is the most common one. Now, the good news is that people rarely die of testicular cancer. It has excellent long term survival rates, but often requires extensive treatment. So, usually it presents as a mass, a testicular mass that a patient can feel themselves, kind of a nodule. And it's usually pretty easy to confirm the diagnosis with an ultrasound. Now, some patients get really freaked out and they are doing a thorough testicular exam every day to make sure that they don't have this. That's likely not necessary. It's usually pretty obvious if there's a mass there, and usually it's something that's going to grow over time. And again, like we said, the survival rate is very high, even if it's grown a fair amount. So you don't have to be that worried about it. Generally, the horror stories of people dying from testicular cancer are usually younger boys who are embarrassed to say anything or want to wait and see if it gets better. And by the time they get treatment, you have a mass the size of an orange or bigger on the testicle, and it's spread to the lungs and so forth. And even then, still potentially curable with chemotherapy and so forth. But most of the time, somebody comes in and says they feel a lump or a mass there, and it's pretty obvious. It's not like they were being very diligent to find it. It's usually pretty obvious that there's a mass there, and the treatment is an orchiectomy, which is just surgical removal of the testicle, which a lot of people are confused about. They ask, why don't you just do a biopsy first? You know, it seems pretty aggressive to remove the entire testicle, but the imaging is usually pretty diagnostic. There are also blood tests that we get that can help confirm the diagnosis, but usually the imaging and exam are a slam dunk, and we just have to go and remove the entire testicle. And most of the time, this is all the treatment you need, right? It's an early stage cancer. We remove the entire testicle. You got yourself a CT scan of your abdomen and pelvis. There's no evidence that the cancer has spread to any of the lymph nodes. We do the blood test after the surgery to make sure that all those tumor markers go down to an undetectable level. And then most of the time, we just have you on a surveillance protocol where we're checking your tumor markers and maybe getting some repeat imaging down the line, and that's it. You're cured. Now, if you have an aggressive type of cancer or if it's already spread to the lymph nodes, then we need to move on to a much more aggressive surgery called the lymph node dissection, which only a very small subset of urologists actually do. So you go to take yourself to a center of excellence where they do these, and you have your lymph nodes removed in the retroperitoneum, which is basically the space where the testicles drain to. Oftentimes, this is done robotically now as opposed to a big open incision, but oftentimes the lymph node dissection is curative, and that's all. That's all you need. Uh, in some cases, you do have to have chemotherapy or radiation, and those obviously have their own side effects that go along with it. But even in the very advanced stages, with chemotherapy, radiation, surgery, it's pretty rare that people die of testicular cancer. It's more so that they have to deal with the consequences of having had chemotherapy or radiation or surgery. So it's definitely better to catch these things early, but it's not something that you need to be extremely worried about. I would say every so often when you take a shower, just quickly feel around there and make sure that there's nothing obvious like a nodule or mass. But it's not something that you need to lose sleep over or think that if you're not very diligent and you miss something, all of a sudden it's going to spread and kill you. That's really not what we see with testicular cancer. So it's something to be aware of, but not something to really lose sleep over.